Hi, we're back again. I'm Rena Azar, Dr. Rena Azar, and this is Dr. Susan Raschal, aka Dr. Suze. And I want to talk today about the cold, and I'm going to ask Susie to expound upon this. So we're going to talk about the common cold. I think it's important for people to recognize that the common cold is a specific disease process. It is not just the symptoms of cough, sneeze, postnasal drip, sinusitis, or sinus fullness, and that you can have different types of infection or disease processes that give those symptoms. So the common cold is what Susan's going to discuss today. The common cold is a viral infection, and women often come to me, or men for that matter, and say, I have these cold symptoms, I want an antibiotic, and she's going to talk a little bit about that because there is a distinction between a bacterial infection. Bacteria respond to antimicrobials or antibiotics. And there's a difference between that and a viral infection. So I'm going to let Suze take it over from here.
So she's absolutely right that when it comes to the common cold, people don't distinguish bacterial from viral organisms. They don't. And frequently they will come in and they are requesting antibiotics. So let's back up a second. What really is the common cold? Well, the common cold is 100% due to viruses. And there are viruses that will frequently affect the upper respiratory system. And it will cause common symptoms of rhinorrhea, which is a runny nose, drainage in the back of the throat that we call postnasal drip. It can cause sometimes watery eyes. It can cause congestion in the face, congestion in the ears. It can even cause body aches. The discoloration that comes out of the nose, people frequently think, I've had the green snot, doc, for the last 5 days. And for sure for them, it's bacterial and they need an antibiotic for that. And the answer is no, because the colored discharge does not distinguish a viral from a bacterial infection, which is an incredibly important point. Sore throat can be associated with that. And one of the things that we worry about when it comes to the cold is common cold, is that other people may have joint and aches and pains. Well, what does that sound like? Well, it sounds like they may have the flu. Guess what? The flu is a viral infection that, again, doesn't respond to antibiotics. And then the other thing, because of this era of the COVID-19 pandemic, is that COVID-19 symptoms are very similar to those of the common cold. So how in the world do you distinguish one from the other? And that can definitely be challenging. So when you come into the office, if you choose to come into the office, you want to give your symptoms, but the time frame is extremely important because typically if someone has symptoms of a cold, their symptoms will last for up to about a week and then it will go away. The other thing I should mention is you can have an elevated temperature with that, with a flu, with the cold, as well as with COVID-19. So it is important to make those distinctions and take it to your provider, your doctor. I am an allergy, asthma, immunology expert, so I will see a lot of people that come in with those symptoms, but particularly because the common cold or viruses can affect not just the upper respiratory system, but also the lower respiratory system. And in people who have asthma, the viruses are a very common trigger for asthma. So people, if they have the symptomology of a cold, they may also have shortness of breath, wheezing, chest tightness, cough, which can be associated with asthma. So it's important that we immediately identify what it is and jump on it. Now, the other thing I need for you to do is be kind to your provider, your medical provider, whomever that is, because people frequently, you think if you've got the cold, you've got the green colored discoloration coming out of your nose, what's the first thing that you want to do? You want to go to your doc and get something you can't get over the counter, which are antibiotics. And please, please, please do not impress or be angry at your doctor if they choose not to prescribe an antibiotic for a virus because they don't work. And the problem with that is there is a condition in medicine that we have become all too familiar with, and that is resistance. So you take an antibiotic for so long, and guess what? The bacteria are clever and they mutate. And when they mutate, that antibiotic doesn't work for them. And the problem is that there are people, even today, that are dying because there isn't an appropriate antibiotic to treat their condition because of this resistance. The other thing that antibiotics can do, especially if they're used improperly, is they can cause side effects, and people can develop allergies to them. And I'm going to talk to you about penicillin allergy, but I just want to make a comment, and that is that 90% of people who have a history of penicillin allergy are actually not allergic to penicillin. And part of the reason is because when they took the antibiotic, which probably years and years ago was penicillin because it was the first antibiotic available, what happened is that they developed a rash, and they called their doctor and said, "Oh my gosh, I've got a rash." And the doc said, "You're probably allergic to it, so stop the medication." Well, what we didn't do is, at that time, there probably weren't good tests to determine if that was truly a reaction, but the illness itself can cause the rash. So now we have just labeled somebody as penicillin allergic, and they may not actually have been penicillin allergic. So, and then the other symptoms, diarrhea, very common symptom of antibiotic use, and other things, not just rash, but not feeling well, and GI upset, abdominal distension, cramping. So it's extremely important. And one of the things that I mentioned to Dr. Azar was the number one reason. I listened to a piece on NPR, National Public Radio, and one of the things that they mentioned, number one reason why docs prescribed antibiotics, number one reason, patient request. And so that can be a problem. So the common cold, how do we treat it? We treat it with over-the-counter medications.
So I'm hearing from you that really people should just wait it out. For what duration would you say?
Well, what the literature shows is that if your symptoms persist for more than 7 to 10 days, then it may in fact be bacterial, and therefore you may need an antibiotic under those circumstances.
So when do you think somebody should come in? I'm going to guess that as an allergy immunology person, you're going to say, hey, if you've got a family member, a loved one who has an asthma tendency, that's a reason to come in potentially and be evaluated, since viral infections can be a trigger for their condition.
And she's exactly right. And part of the reason for that is because there is this unawareness that sometimes people cannot perceive that their lung function is starting to drop until it drops significantly to the point where they have symptoms. So if someone does have symptoms, particularly if they have symptoms of cough, wheeze, shortness of breath, chest tightness, they definitely need to be coming in so that we can address the lower respiratory symptoms that are ongoing. And then we can also, sometimes I will take out the time to explain the reason why we do not prescribe antibiotics for viral infections. And I will tell you, just like I told you in that NPR report, one of the problems was that it's easier for a physician, if they're trying to be very time conscientious, to just write the prescription for the antibiotic per your request instead of taking 5 minutes out of their busy day to explain to you the reasons why the antibiotic will not help and is not the appropriate treatment.
And I think you're going to tell us that most of the cold-like symptoms that people have are due to a viral infection. But there are some people that might have pneumonia or some other condition that give them these symptoms. So when would you recommend symptomatically that somebody come in?
So if it's isolated to the upper respiratory system, and it truly is symptoms that are suggestive of the common cold, and the lower respiratory system is not involved, then you may be able to wait it out. And what I'm going to do is do what you've been taught by your grandma, and that is some nice tea with lemon, honey, as well as ginger in it, which is going to be extremely helpful, and it's soothing and it's warm. Take antipyretics or medicine that will bring down elevated temperature. If you have that, you can take medicines that will also help with muscle aches and pains. But again, if you feel like something is amiss, or if there's an asthma component, that should be evaluated sooner. And again, when it comes to a pneumonia, usually it will give you lower respiratory symptoms like cough, wheeze, shortness of breath, chest tightness. If you're coughing up blood, or if you're a smoker, you're more likely to have symptomology associated with cold. So those are things to look at. And I shared with Rena previously that my grandma would always tell me, because one of the key things that I've heard is when you go outside and it's cold, you're going to catch a cold.
We've all heard that.
And I've told my grandma for years, Grandma, you don't catch a cold from going outside, because she would say, put your undershirt on when I was a little kid. Put your undershirt on and wear a hat. And as she got older and I got wiser, I tried to explain it to her. But again, when I got older and wiser, when she told me to put the hat on because I would catch a cold, yes, Grandma, I just would do it. And she earned that because she died at 105 3/4, which is pretty remarkable for our family. And so I just honored her and just went with it. But the truth is that you don't catch a cold from going outside. You catch cold from person to person spread because of viruses.
And on that topic, one last note, which is, of course, all that we talked about today is a little bit different in the context of the COVID-19 because it is important to know if you have COVID-19. So whereas normally people are told don't necessarily come in for cold symptoms, unless you have some of the predisposing factors that Susie talked about, or certain specific symptoms or underlying asthma. These days you do go in a little sooner to investigate cold symptoms because you don't want to bring that particular virus to your workplace, to your loved ones, or elsewhere. So we do advise people to go in more frequently unless they're willing to just isolate without doing testing and get tested for the COVID-19. And we appreciate your time today.
Well, I did want to make a comment. With the COVID-19, if you call our office, because we don't want you to bring COVID-19 into our office either, and neither does Dr. Azar, we'll encourage you to get the test for it so we know what we're dealing with. Because if it is just a cold and your COVID-19 test is negative and you've had symptoms for more than 2 days and it should show up positive, then we will treat that differently than how we treat the common cold.
Absolutely. So thanks again. Thanks for now, and we'll look forward to talking with you soon.